Welcome to the Surgery and Therapy Summit interview with Dr. Paulvalery Roulette, who's all the way over from Charlotte. Welcome. Thank you so much for joining
Yeah,
us.
thank you for having me. Look forward to participating. I'm really excited to actually show some people some cadaver work with CMC arthroplasty to give you an idea of what the purpose of the surgery, some of the complications that can happen during surgery, and then hopefully it shows some people some new stuff with suture suspensioplasty, which to, at least from my eye, allows patients to get some immediate weight bearing and may actually shorten their therapy time. So I'm looking forward to having that discussion with people.
Oh, well, we're so grateful to have your experience. So, Dr. Roulette, you're an orthopedic surgeon, and you've actually only been in practice for 3 years, but you are flying in your career. Do you want to just let us know a little bit about why you decided to become a hand surgeon?
Oh, so I mean, shoot, going back in time. So my family, giving you more of my background. So I'm in Charlotte, North Carolina. So I'm American, but my family's from Haiti. So I'm Haitian American. And basically, just like the joy of going and being a doctor came just being a kid and being good at sciences. And I love talking to people. So that all meshed together. When I was in med school, I actually hated surgery. So,
Okay.
so, so my love for surgery actually came through OBGYN. And that's
Oh,
because going into there was stuff that was fixable. It's like either I could fix it with medicine or fix it with surgery. And I was trying to choose between OBGYN and primary care with sports medicine. And while on a sports medicine rotation with an orthopedic surgeon, that's when I fell in love with orthopedics. And that was the tools, the big bones, the big exposure. And that was great. And then during residency, I ended up falling in love with hand surgery because it adds to that, which is really the nerve work and the blood vessel work. So that intricate stuff, and then honestly, I would be thinking about the hand patients the most because their problems were really difficult and still difficult to handle because it's much more than bones. The soft tissue is so important. So that's why it's interesting to me. Those are the things that bring it to the for
it's a
anybody.
nice journey that you've been through. And I think you're right. There's something very unique and special about a hand injured patient because they're fit, they're well, they had a life that was so busy, and they were obviously fulfilling their career goals or they, as you say, their sporting goals and achievements, and suddenly they're injured and that's taken away from them. And there's nothing more powerful and exciting in our position to be able to get them back to what they were doing and what they loved and to become top performers again.
Mhm. I agree. No, I agree. It's that whole I mean, it's that whole spectrum because I get to do sports, I get to do arthritis surgery, I get to do trauma. So it's all over the place. So it's a unique field because a lot of the things that would make someone want to be a generalist, I think you get with being a hand surgeon, but also being a subspecialist. So I love it. It's like you can go through a day of 9 to 12 surgeries and have totally different surgeries at different paces, and it keeps it interesting.
Absolutely. So, to become a board certified orthopedic surgeon, it is recommended that you do a fellowship, and you did do your fellowship in Philadelphia. Do you want to tell us a little bit about that?
Yeah, again, I'm board certified with orthopedic surgery board certified, and I did do a hand fellowship, and that was in the Philadelphia Hand Center, affiliated with Jefferson University. And then my fellowship chairman would be Dr. Osterman, who's a hand giant, a great. That experience was amazing. Osterman clinics that would last from like 8 a.m. to 10 p.m., 11 p.m., and that's back when he was slowing down. And but the thing that was unique about it was Dr. Osterman's, at least his thought process is that if I was seeing a patient for a trigger finger, I was examining their brachial plexus down. And you would have these patient encounters that would be at the minimum 30 minutes. So that way you understood everything that was happening in that person's upper extremity. So what was nice about it is it made you efficient because you had to be efficient. And then it had you think about the patient globally, at least from the upper extremity standpoint. And
Mm.
then all the other mentors within the Philadelphia Hand Center are just amazing. So and it ranged. We had our younger attendings to the more established ones, and each one bringing their own personality and their ideas to it. So my Philadelphia Hand Center experience was second to none. That was amazing for me.
I can so relate because I got to spend 4 days with Dr. Osterman on a rotation just before the Philadelphia conference, which I think at that time I did elbow. It's on a rotation. And I had never known a work ethic like that. And and as you say, I think it was what was so incredible was this hand surgery therapy partnership where there were all these rooms and there was a system and all the therapists kind of did the assessment, and then when Dr. Osterman walked in, we presented what we saw, and as you say, your assessment skills and your presentation skills improved significantly just from that experience.
Well, it's and now looking back at it, you can see that it was just by design. So you're thinking that like you came in for 4 days, but while I was there was also therapists that were there for fellowship for the whole year. So we would have our morning conferences, which was the surgical fellows, which our surgical fellows could be a mix of orthopedic surgeons or plastic trained surgeons, and then our therapists who are there in the same room. So as colleagues, you're treated the same and we're learning the same. And then by design, if you remember, Osterman's rooms were right next door, literally the hallway right next door to where they did therapy. So you'd walk the patients over to the other hallway and literally have a face-to-face encounter with the therapist. So naturally, it made the therapy hand surgeon relationship a natural one that was expected to happen. And I feel like that's it's been something that I've done in my career with, at least I hope my therapists feel that way with the way I work with them now.
Yeah, no, it is the best way. I worked like that in London as well. We just had our rooms next door to each other, and it is something that I miss in private practice in South Africa. So you had a really good grounding and a phenomenal mentor who I'm sure has played a significant role in how you choose to be as a surgeon and as a colleague, which is just so fantastic. And then where did you go from there?
So then got my first job. So I'm in Charlotte, North Carolina. I work with Novine Health. I'm a hand surgeon here. I take hand call. I'm one of two within the system right now. And it's been incredible. Things that have changed in my practice during this time. I introduced endoscopic carpal tunnel release for the system in the Charlotte area, taking wide awake surgeries and adding it to my repertoire, especially with my flexor tendon surgeries, simple things like trigger fingers and other masses, and it's been incredible. It's changed how I do my therapy, allowed me to be more aggressive with therapy protocols, knowing how good my repairs were, like after checking them wide awake. So it's been a journey, and again, it kind of shows the a lot. My practice now is even different from what I imagined when I was coming out of fellowship, and that's just because we're continuing learning. So, I mean, anybody that's participating in these kind of summits, I think they're doing that because they're trying to learn something so that they can add it to their practice and then be better, change.
Yes, and exactly, and that was my vision when selecting the presenters for the summit, and also just the whole concept of the summit of practical learning. So by you demonstrating what you've learned, there will be so many surgeons out there and therapists who are trying to understand what you're doing so that we can make our rehab better. I think it's a unique opportunity, and I feel that probably become more mainstream. Do you think with future conferences?
Well, so in the sense of, well, repeat that question again. What do you mean?
So in terms of summits, when we go to conferences, generally we're watching people present results, statistical data, results. I've seen, I've done this procedure and I've seen 100 patients and these are my results, versus this summit where we're actually rather focusing on the practical learning in terms of your skill and how to perform the procedure.
So I feel that at least in my time of education, that is what has been switching over. So specifically, I would give the American Hand Society, the ASSH Hand Society of the United States, and the stuff that they've done over the years. So that's with adding a lot more video of actual surgeries that are being done, encouraging videos to be made at the conferences that we do, and then actually setting up stuff for their members where they have a big video library of of looking at surgical procedures, things that have to go along with therapy, just beyond the panels presenting their results. And it makes sense because what we do is we touch people, we do surgery.
Yeah.
We have therapists that are actually, you're doing your therapy on your patients. You actually want to see what does it look like when someone's doing that. And being in what we do, which is apprenticeship model, we're visual learners. We need to see how someone does something so we can try to bring it in for ourselves. So I think I love when people have videos, because videos are just, they speak so many more words than just a paper.
Absolutely, because we're researchers by default, but we are practitioners
Yeah,
primarily.
100%, 100%,
Yeah.
100%.
The other focus of the summit is on holographic surgery, virtual reality, augmented reality in the metaverse. What are your thoughts on this concept?
Well, I mean, it's an exciting time. I mean, I'm a video game kid. I grew up on like Nintendos, the PlayStations, and I've like already dabbled with like VR stuff, but mostly for entertainment purposes. What's interesting about all of these things with augmented reality, the metaverse concepts, is that it's a unique way of educating people, and also a unique way that you can actually to get people involved, possibly in procedures or cadaver labs that they didn't have a chance for before. And I think from especially getting people to connect from long distances, the same way that Zoom is kind of, the pandemics has shown us how much the things that we can do with Zoom and connecting that way, and adding even more opportunities for education to touch even more people, the same way the metaverse, augmented reality, holographic stuff can work.
I agree. And as we were saying before we came online, one needs to have good internet connection, and that might be our only limiting factor.
Yeah, and so this is something. I mean, even in the United States, this is kind of a crisis that you'll see in areas that are more socioeconomically on the downside, that they don't have good enough broadband internet connections that separates them from being able to do things like work from home, use Zoom. When kids were stuck at home during the pandemic, you'd have children in areas with bad signal that literally would have to drive to a parking lot to use Wi-Fi, some other local thing, which again is showing how broadband is something that's becoming a must-have in modern day society if you want to participate. And the question is really, should broadband be something that's considered like a utility, the same way you get water or electricity? For what we do in our jobs today, broadband's needed in order for people to stay on top of doing their jobs.
Absolutely. It's just a basic human right, because that's what education is. And I think that the metaverse is going to change education. It's probably going to change our children's schooling. Our children might end up going to the first metaverse university, but the experience that they have will not be a Zoom experience where you're sitting there and watching somebody's presentation. Has the potential to be a fully immersive experience and extend opportunities to those that absolutely could never afford those opportunities. I mean, imagine I could now go and attend one of Dr. Osterman's clinics from South Africa virtually and just have that experience versus having to, fly there, spend a lot of money, book into hotels. So it makes it more affordable.
No, it's democratizing education again. The same things that came along when the internet came in, and allowing people to have access to so much material in order to learn things that before you'd have to go to a library or have to pay for a subscription to a magazine. You democratized information for people. And now with something such as a metaverse or augmented reality, again, open up the ability for someone to learn something that they don't have a local resource to. And that the only thing that can do, like at least in my eyes, the only thing that I can do is it just brings more people into the room that can participate at a high level. And then the only thing that can do is increase innovation. And that's what you want.
Absolutely. But to have that innovation, you need to experience it. And
Yes.
it's creating the experiences. And I think that is why your participation in the summit has meant so much to me, because you're enabling that experience with other surgeons and therapists.
It's exactly. So it's unique, right? Before, in order for us to touch an international community, I would have to show up someplace
Yes.
and hope and hope the international community would be there.
Yeah.
Versus you get to create something, put it up there, and anybody around the world who has access can access it. So it's a unique time. It's a great unique time, and I love anything that actually helps to build to promote a global community that's trying to better take care of patients. So it's great. This is a great time to be in.
It is. I think it is. It's a great time to be alive doing this work. And I do believe that even what I've created now is going to be so obsolete and completely different in a year or two, because it is changing so drastically. And all we can do is keep up and just keep changing and adapting, and also just keep dreaming. This always starts with a dream. And
100%. 100% always starts with a dream. 100%. To keep on dabbling. But the thing that's fun about this is that I think a lot of times people are looking at innovation coming from maybe like a 12-year-old doing something. It's just like, no, you're seeing people who just have the tools and they try something and then it works, and then they get to spread it regardless of age, ethnicity, socioeconomic background. If you have internet access, and you have the will, you have all of these tools that you can use to educate people or to learn.
Yeah, lots of fun. Okay, so in terms of your career, where do you see yourself going? Are there things that you still feel you need to explore? What is your vision for the next 5 years?
Oh, so that's, I mean, for me, there's always things that you want to get better in, and to get better in and grow in. Things that I find interesting. Oh, so things that I find difficult are it's going to be elbow trauma and ligamentous injuries, and that's something that in my career right now, that's what I'm trying to focus on some more, because we see that, and the results are suboptimal. Really, what we're trying to do is take someone from a really bad elbow to a stable elbow that's still going to be stiff. And then again, just trying to figure out how do we do that better. From the hand side, there's things that we still don't do well. So what do we do with scapholunate ligament injuries that are not just acute but subacute? Like, how are we truly doing things that bring that relationship between the lunate and scaphoid back to what it normally does, which right now we don't. But like pioneers like Scott Wolf, who have spent their career just focusing on those things and trying to better understand the mechanisms of how that the wrist works. Like, I'm looking forward to seeing the changes that get made with that. But I mean, of course, there's always growth in my career as a surgeon. And then from, I guess, other things is trying to figure out leadership in the sense of how do we better bring care to patients. So I work in a large hospital system, but making sure that we're bringing equitable care to all patients. And I get to do that focus through orthopedics. So there's like leadership things that are there too, but it's all interesting. And then at the same time, I have kids. So I'm trying to focus on being the best dad that I can, and trying to figure that out.
You've done it all simultaneously, which is so.
Apparently, it's the only way to do it. It's the only way to do it simultaneously.
I agree. Well, thank you so much for your time and your insights, and I'm really looking forward to looking at your cadaver operation or procedure and learning from you. And I'm sure everybody else will be attending the summit will be as well. So thank you so much for participating.
No problem. Thank you for inviting me.